in this section, we're going to talk about primary survey. And the primary survey is something that we're going to do when we arrive at the scene in order to assess for anything life-threatening and see the extent of somebody's injuries. So when we arrive at a scene, we've already said that we need to make sure that we are safe. So the first thing we're going to do is we're going to look for any danger. There's actually an acronym that is quite helpful to remember these primary survey steps, which is DOTTA ABC. So D is for danger. So when we arrive, we're going to assess the scene and make sure it's safe to approach the casualty. So is there any gas, glass, fire, wire, or anything else that could be any danger to you? When we approach the casualty, we will see if they are alert and if they're sitting up, if they're talking to us, maybe if they're asking us for help. So we're going to look at different scales of response levels now. So we're now on R for response. So are they alert? Like we said, did they respond to us? If they're not alert, we're going to move down to the next scale, which is, do they respond to any voice prompts? So, hello, can you hear me? Can you open your eyes? And I'm going to do that by talking into the casualties, both of their ears, in case they're hard of hearing in one ear. So, hello, can you hear me? Can you open your eyes? You may ask them to squeeze your hand as well to see if you have any response there. If that doesn't work, what I'm going to do is place my hands on their shoulders and give them a little shake to see if they respond to that. If they don't, at that point we would deem them unresponsive. And you want to make sure that you've got some help at this point. If there's no one around, just give a quick shout for help. And now what we want to establish is if they're breathing normally. First, before we do that, we need to make sure that there's nothing in the casualty's mouth, because what we're now going to do is open the airway. Okay, so we've done danger, we've done response, and we're now on to A for airway. So check the airway, make sure there's no vomit. If there is, we can turn the casualty away from us or place them into a recovery position in order to clear that vomit out. And then what we want to do is open the airway. So we're going to put one hand on the forehead and 2 fingers underneath the chin and do a head tilt chin lift in order to open the airway. So by doing that, we may have already preserved their life. So by them relaxing, if they're unresponsive, all their muscles could relax and the tongue could block off the airway. By doing this, this has taken the tongue off the back of the throat and potentially enable them to be able to breathe. So now we're on to B, so that's breathing. So we're going to check for breathing. So how we're going to check for breathing is we're going to look, we're going to listen, and we're going to feel. So we're going to look for normal breathing by looking down the chest. We're going to feel for normal breathing on our cheek, and we're going to listen for normal breathing. And we're going to do that for 10 seconds. We're going to say that this casualty is breathing normally. So we then move on to our C, which would be either CPR or circulation. In this case, this casualty doesn't need CPR. So what I would do is, with regards to circulation, just make sure there's no severe blood loss that's appearing. So I haven't noticed any pooling of blood or any damp clothing that could indicate that there is a bleed under their clothing. So that's your primary survey, your DOTTA ABC, danger, response, check and open the airway, check for breathing, and check the circulation or start CPR if your casualty isn't breathing. So our casualty was breathing normally but was unresponsive. So we need to make sure that they stay safe and that they can maintain an open airway. In this position, that might not be possible for this casualty. So the best position to put them in is what we call the recovery position. So the recovery position will maintain their open airway as they're on their side. So if the tongue won't be able to relax on the back of the casualty's throat, and if they are sick, they will not choke on it. I'm now going to demonstrate your primary survey into recovery position. So I've come into this room and I have found somebody on the floor that appears to be unresponsive. So first thing I'm going to do is I'm going to check for danger. So I'm going to make sure there's nothing around that's going to injure me or further injure my casualty. So I've checked for danger and it's safe to approach. I'm now going to check for response. Hello, can you hear me? Can you open your eyes? Can you squeeze my hand? There's no response. I'm now going to just make sure that the airway's clear, and I'm going to do a head tilt chin lift in order to open the airway. I'm now going to check for breathing. Okay, the casualty's breathing normally. I can't see any signs of any injuries, and I cannot see any medic bracelets that might indicate that he has a medical condition, and there's no severe bleeds. But I am concerned because he has been unresponsive for a good couple of minutes. So I'm going to shout for some help, and I'm going to ask somebody to get me an ambulance and a first aid kit. So I want to place the casualty in the recovery position so that they can maintain an open airway, especially if it's myself that needs to go and call the ambulance and get the first aid kit if I was on my own, for example. So I know I can leave him and the tongue isn't going to relax on the back of the throat, or he's not going to be sick, and that's going to compromise the airway. So the recovery position, the arm closest to you, you're going to move just up out of the way, anywhere that it will naturally go, because basically we're going to bring them towards us and we don't want them to squash their arm. I'm now going to get the hand furthest away from me, and I'm going to link fingers, and I'm going to put his hand on his cheek here. If the casualty is wearing any big rings, I would just turn them around so it doesn't dig into their cheek, and I'm going to keep my hand here at all times throughout the turn. From the outside of the leg, the furthest leg away, I'm going to lift up at the knee and get the foot as close to the bottom as possible. I'm now going to use this as my lever. So it shouldn't matter what size I am or what size the casualty is, I should be able to turn them if I'm using this method. So push down as hard as you need to on the leg. And just bring that foot off that leg there. Bring the shoulder over. And most importantly, make sure that the casualty's airway is open. So just make sure the chin isn't right against the chest. You can open the mouth. And just make sure that airway is open. You can now check the back from this point as well to make sure there's no injuries. To continue to check for their breathing, we can put our hand in front of their face and feel for the breath on our hand. And we can also see the rise and fall of the chest on the front and back here as well. Some other things to consider during the recovery position is if the casualty has anything in their pockets. Because if you're rolling them onto a side where they've got lots of keys or phone, that might be quite uncomfortable, so you might need to think about rolling them onto the other side. Also, if they're wearing glasses, you may want to consider taking those off because that can also be quite uncomfortable for them. It doesn't matter what side you roll your casualty on, unless there's any injuries to consider, and usually that would be injured side down. However, if you have a heavily pregnant lady that is required to be placed in the recovery position, then you should roll her onto her left side to make sure that we don't cut off any blood supply to baby or mum.